Hi, we're Pioneer, the UK's largest specialist team dedicated to treating patients with wounds and lymphedema. So recent research tells us that approximately 3.8 million people in the UK have a wound, many of which suffer with complications that stop it healing. We also know that 500,000 people in the UK have lymphedema, and many more with conditions such as lipedema, which remains a much greatly misunderstood condition. But these aren't just conditions. We hear daily from patients how they affect their quality of life, they suffer from pain, embarrassment and loss of income. And for a lot of people, they just need somebody that understands their condition, that they can reach out to and get treatment.
I cut my leg quite badly after a fall from a ladder. I went to an A&E and had 12 stitches and expected it to heal quickly, but the area got more and more sore and quite red. It was starting to keep me up at night and I couldn't sleep. After a couple of days, I was feeling quite unwell, so I went back to the hospital, who gave me some antibiotics. After another few days, it still didn't seem to be getting any better. I was told that there could be a real risk of a more serious infection, ending in a hospital stay. I was told by one nurse these sort of wounds even sometimes result in the loss of a leg, which you can imagine scared the life out of me. I couldn't believe that from just a cut on my leg. I heard about the Pioneer Centre and contacted them out of desperation, really. The lady on the phone that I spoke to was really reassuring and booked me in to be seen really quickly. I saw a specialist nurse that made me feel at ease right away and understood all of my concerns. They spent over an hour with me and explained to me that the circulation in my legs wasn't great and that I had venous disease. They applied a specialist dressing and a compression bandage to my leg. It worked, obviously, as I didn't get any more infections, and although it still took longer than expected to get better, my leg has healed up now and I'm back out working.
And you're not alone. You're not alone in this journey. We at Pioneer help thousands of patients every month in our clinics across England. We have a large specialist team of specialist nurses, we have podiatrists, dietitians, lymphedema practitioners, doctors and surgeons too. We work with you to achieve your goals using our motto, heal, optimise, prevent and educate. And using this motto, we can help you live the best life that you can.
But our work doesn't stop there. We work with colleagues around the world to find innovative and evidence-based methods, treatments to support patients with wounds and lymphedema. Today, we use treatments and techniques to support patients with wounds and lymphedema that are evidence-based and have been scientifically tested in the years gone by. So we know our practice is safe. But from our centre in Inverness, we are testing new techniques, new methods that will guide practice in the future. But it's critical for us that as we do our research studies, we provide techniques and methods that are evidence-based and we follow the science. Our research takes many forms. Here in Inverness, we're working with healthy volunteers to evaluate in a risk-free environment techniques and methods that might make it to patients with clinical needs in the future. We're also working here in the laboratories to test products and methods to ensure that they reach the right regulatory standards before they reach the patient. And once we're ready, we conduct and control clinical studies from our base here in Inverness across our clinics in England and with our research partners globally.
Healing isn't always about finding a cure. Sometimes it's about finding some progress, helping understand how we can best manage your condition and reclaiming some daily dignity, reclaiming your quality of life day to day. And we understand and know how frustrating it can be waiting to see a wound and lymphedema specialist. So here at Pioneer, we have a dedicated team waiting to take your call. You can find us online or on the end of a telephone. We have somebody waiting to book you in to see us at one of our clinics in England, or even a virtual consultation if that works best for you. We're Pioneer and we're here to give you hope.